Hello, welcome to my channel. Subscribe or like if you like it. Today we are going to talk about the medicine carbamazepine. We will explain its mechanism of action, side effects, dosage, uses, contraindications, warnings, pregnancy and indications. The trade names of carbamazepine are Tegretol, Carbatrol, Tegretol XR, Epitol. 1. What is carbamazepine and what is it used for? Carbamazepine belongs to a group of medicines called antiepileptics. It is used to treat certain types of epilepsy. It is also used in the treatment of mania and in the prevention of manic depressive, bipolar, disorders, in alcohol withdrawal syndrome, essential trigeminal neuralgia and essential glossopharyngeal neuralgia. 2. What you need to know before you start taking carbamazepine. Follow the instructions your doctor has given you. Do not take carbamazepine. If you are allergic to carbamazepine, to any medicine similar in structure to carbamazepine, or to any of the other ingredients of this medicine, listed in Section 6. If you have severe heart disease. If you have or have had in the past any serious blood disease. If you have problems in the formation of porphyria, a pigment important for liver function and blood formation, also called hepatic porphyria. If you are taking medicines belonging to a special group of antidepressants called monoamine oxidase inhibitors, MAOIs. If you are in any of these situations, consult your doctor before taking this medicine. If you think you may be allergic, consult your doctor. Warnings and precautions. Carbamazepine should be administered only under medical supervision. Consult your doctor or pharmacist before starting this medicine. If you have suffered in the past or suffer from heart, liver or kidney disease. If you have or have had any blood diseases, including those caused by other medicines. If you have elevated intraocular pressure, glaucoma. If you have a mental illness called psychosis and also if you are elderly and suffer from confusion or agitation. If signs suggesting a serious skin disease appear. If changes in sensitivity, rash or other signs of allergy, to oxycarbazepine or other medicines, such as phenytoin, another anti-epileptic drug, have been observed. It is important to mention that if you are allergic to carbamazepine, the chances are 1 in 4, 25%, that you may have an allergic reaction to oxycarbazepine, triletol. If you are a woman and take oral contraceptives, carbamazepine may make birth control pills ineffective. Therefore, different or additional non-hormonal methods of birth control should be used while taking this medicine. This will help prevent unwanted pregnancies. Consult your doctor if you have irregular bleeding or spotting. If you have any questions, consult your doctor. If you encounter any of the following, consult your doctor immediately. In case of onset of fever, sore throat, skin rash, mouth ulcers, bruising easily and for no apparent reason or purplish spots on the skin, see Section 4. Possible adverse effects. It is very important that your doctor monitors your treatment at regular visits and tests your blood and urine at the beginning of your treatment and regularly throughout your treatment to rule out any abnormalities in your blood and liver or kidney function, and also sometimes to monitor the most appropriate carbamazepine dose. If a skin reaction such as rash, redness, blistering of the lips, eyes or mouth, or peeling accompanied by fever occurs, tell your doctor immediately. These reactions may be more frequent in patients from Asian countries, for example Taiwan, Malaysia and the Philippines. The occurrence of serious adverse skin effects is rare with carbamazepine. In people of Chinese and Thai origin this risk can be predicted by a blood test. Discuss this with your doctor before taking this medicine if you are of such origin. If an allergic reaction such as fever with swollen lymph nodes, rash or blisters on the skin occurs, consult your doctor immediately or go to the nearest hospital. See Section 4. Possible side effects. Life-threatening skin rashes, Stevens-Johnson syndrome and toxic epidermal necrolysis, have been described with the use of this drug, initially appearing as reddish circular spots or blotches, often with a central blister. Additional signs that may appear are sores in the mouth, throat, nose, genitals and conjunctivitis, swollen, red eyes. These life-threatening skin rashes are often accompanied by flu-like symptoms. The rash may progress to generalized blistering or a peeling of the skin. The period of greatest risk for severe skin reactions is during the first few weeks of treatment. If you have developed Stevens-Johnson syndrome or toxic epidermal necrolysis with the use of this medicine, you should not use carbamazepine again at any time. If you develop rashes or these skin symptoms, stop taking carbamazepine. See a doctor immediately and inform him/her that you are taking this medicine. Epileptic seizures may occur due to discontinuation of the drug. If you experience an increase in the number of seizures, consult your doctor immediately. If you notice symptoms suggestive of hepatitis, such as jaundice, yellowing of the skin and whites of the eyes, consult your doctor immediately. If at any time you have thoughts of harming or killing yourself. A small number of people who have been treated with anti-epileptic drugs such as carbamazepine have had thoughts of self-harm or suicide. If at any time you have these thoughts, contact your doctor immediately. Do not stop treatment with this medicine without first consulting your doctor. To prevent a worsening of epileptic seizures, do not discontinue treatment abruptly before any surgery, including dental surgery or emergency treatment. Tell the attending physician that you are taking carbamazepine. Use in elderly patients. Carbamazepine can be used safely in elderly patients in accordance with the physician's instructions. If necessary, special information on dosage and measures to be taken into account will be given. Use in children. Carbamazepine is safe for use in children according to the physician's instructions. If necessary, special information on dosage and measures to be taken into account will be given. Taking carbamazepine with other medicines. Tell your doctor or pharmacist if you are taking or have recently taken other medicines. Carbamazepine can interact with a large number of other drugs, which can both increase and decrease the effect of carbamazepine and those drugs. This warning applies to prescription and over-the-counter drugs and especially to vitamins, vitamin B3, oral contraceptives, analgesics such as paracetamol and preparations containing St. John's wort. During treatment with carbamazepine, avoid using medicines containing alcohol. Taking carbamazepine with food, drinks and alcohol. You can take this medicine with or without food. You should avoid drinking alcohol during treatment with carbamazepine. Alcohol may increase the risk of side effects. Do not drink grapefruit juice or eat grapefruit as it may increase the effect of carbamazepine. Other juices, such as orange or apple juice, do not have this effect. Pregnancy, lactation and fertility. Pregnancy. If you are pregnant or breastfeeding, think you may be pregnant or intend to become pregnant, consult your doctor or pharmacist before using this medicine. Although epilepsy already carries a higher risk of developmental disorders in your offspring, including congenital malformations, than in the general population, the different treatments available may generally increase this risk. Specifically for carbamazepine, there is a possibility of increased risk of spina bifida, skull and facial, cardiovascular and urinary system malformations, in addition to the possible treatment withdrawal syndrome that may occur in the newborn. Therefore, we advise you. If you become pregnant, plan your pregnancies in consultation with your specialists. In case you are pregnant, consult your neurologist. In neither case should you interrupt treatment on your own. Untreated epilepsy harms both the fetus and the mother because of the possible aggravation of the disease. In these situations, the doctor may prescribe supplementary treatment with folic acid before and during pregnancy and vitamin K1 in the last weeks of pregnancy, in the latter case also for the newborn. In addition, the pregnancy will be monitored more closely. In any case, any woman of childbearing age should always consult her physician about alternative contraceptive measures as carbamazepine normin may decrease the efficacy of oral contraceptives. C-section use of other medicinal products. Breastfeeding. Advise your doctor if you are breastfeeding. The active substance containing carbamazepine passes into breast milk. As long as your doctor agrees and the child is monitored for side effects, you may breastfeed. However, if adverse effects appear in the infant, for example drowsiness or skin rashes, discontinue breastfeeding and consult your doctor. Fertility. There have been reports of rare cases of impaired male fertility. Driving and use of machines. Carbamazepine may produce symptoms such as drowsiness, dizziness or visual disturbances, and decreased ability to react. These effects as well as the disease itself may impair your ability to drive vehicles or operate machines. Therefore, do not drive, operate machines or engage in other activities that require special attention until your doctor assesses your response to this medicine. 3. How to take carbamazepine. Follow exactly the directions for taking this medicine given by your doctor or pharmacist. If in doubt, consult your doctor or pharmacist again. Do not exceed the recommended dose. Carbamazepine should be taken regularly and exactly as directed by your doctor. This will help you get better results and reduce the risk of serious side effects. Do not take extra doses of carbamazepine, do not take it more often than directed, and do not take it for longer than prescribed. Do not stop treatment abruptly before consulting your doctor, as this may make your condition worse. Your doctor will tell you what to do. How much carbamazepine you should take. The doses prescribed by your doctor may be different from those given. Always follow your doctor's instructions. In general, the starting dose in adults for the treatment of epilepsy is 100 to 200 mg once or twice a day. This dose is gradually increased to 800 to 1,200 mg a day. In some patients a dose of 1,600 mg a day may be necessary, divided into 2 or 3 divided doses. Treatment in children is usually initiated with a dose of 100 to 200 mg per day, 10 to 20 mg/kg/day, and gradually increased to 400 to 600 mg. Adolescents may receive 600 to 1,000 mg per day. For the treatment of trigeminal neuralgia, the initial dose is 200 to 400 mg daily, increasing slowly until the pain disappears, usually 200 mg 3 to 4 times a day. In elderly patients, a lower initial dose, 100 mg twice daily, is recommended. For the treatment of mania and for the prevention of bipolar affective disorders, the usual dosage is 400 to 600 mg daily. The dosage ranges between approximately 400 and 1,600 mg daily. Your doctor will tell you the exact dose of carbamazepine you should take. How and when should you take carbamazepine? Except perhaps on the first day, carbamazepine tablets should be divided into 2 to 4 daily doses, depending on your clinical condition. Always take carbamazepine during or after meals with a little liquid. The tablet can be divided into equal doses. If you take more carbamazepine than you should. In case of overdose or accidental ingestion, tell your doctor immediately. You may need medical attention. If you experience shortness of breath, fast and irregular heartbeat, loss of consciousness, tremors, dizziness, nausea or vomiting, you may be taking too high a dose of carbamazepine. If you forget to take carbamazepine, do not take a double dose to make up for missed doses. If you miss a dose, take it as soon as you can, except if it is almost time for the next dose. In this case, wait and go back to the usual dosing schedule. Do not double the dose. If you miss several doses, consult your doctor. If you stop taking carbamazepine. If you have any other questions about the use of this medicine, ask your doctor or pharmacist. Do not change or stop your treatment without first consulting your doctor. If treatment is stopped abruptly, epileptic seizures may occur. 4. Possible side effects. Like all medicines, this medicine may cause side effects, although not everybody suffers from them. Carbamazepine may cause side effects, which are mostly mild and transient. They are more frequent in some people, such as elderly patients, and usually disappear after a few days of treatment or after a dose adjustment, especially some of those affecting the nervous system, the stomach and intestine, and allergic skin reactions. Some side effects may be serious. Consult your doctor immediately or have someone else do it for you if any of the following side effects occur, as they may be the first signs of serious damage to your blood, skin, liver, heart, kidneys or other organs and may require urgent medical treatment. If you have a fever, sore throat, rash, mouth sores, swollen glands or have an easy time catching infections, a symptomatic sign of a lack of white blood cells. If you feel tired, have a headache, become short of breath when exercising, are dizzy, pale, have frequent infections with fever, chills, sore throat or mouth sores, if you bleeds or has more bruising than normal, if you have nosebleeds, a sign of a lack of blood cells, if you have a skin rash with reddish spots usually on the face that may be accompanied by fatigue, nausea, loss of appetite, a sign of systemic lupus erythematosus. If you have yellowing of the whites of the eyes or skin, sign of hepatitis. If you have darkening of the urine, signs of porphyria or hepatitis. If you have a decrease in the amount of urine or blood in your urine, signs of kidney disorders. If you have severe pain in the upper abdomen, vomiting, loss of appetite, signs of pancreatitis. If you have a rash, redness of the skin, blisters on the lips, mouth or eyes, peeling of the skin, accompanied by fever, chills, headache, cough or body aches, signs of severe skin reactions. If you have swelling of the face, eyes or tongue, difficulty swallowing, wheezing, hives and generalized itching, rash, fever, abdominal cramps, chest discomfort or tightness, difficulty breathing, inconsistency, signs of angioedema and severe allergic reactions. If you have lethargy, confusion, muscle twitching, or significant worsening of seizures, signs that may be associated with low blood sodium levels. If you have fever, nausea, vomiting, headache, neck stiffness, or extreme sensitivity to bright light, signs of meningitis. If you have muscle stiffness, high fever, alterations in consciousness, increased blood pressure, excessive salivation, signs of neuroleptic malignant syndrome. If you have irregular heart rhythm, chest pain. If you have altered consciousness, fainting. Very common side effects, occurring in more than 1 in 10 patients. Loss of muscle coordination, dizziness, drowsiness, fatigue. Allergic skin reactions, skin lesions with redness, itching and swelling, urticaria, which may be severe. Common adverse effects, occurring in less than 1 in 10 patients. Swelling of ankles, feet and legs, edema. Headache, blurred vision, clouding of the lens of the eye, double vision. Behavioral changes, confusion, weakness, increased seizures, flares, itching with redness and swelling in the eyes, conjunctivitis, feeling of pressure/pain in the eyes, sign of increased pressure in the eyes, tremors, abnormal involuntary movements, muscle spasms, involuntary eye movements. Rare adverse effects, occurring in less than 1 in 1,000 patients. Itching. Swelling of the glands. Hallucinations, tinnitus or other unexplained noises, decreased hearing, depression, restlessness, anorexia, agitation, aggression, confusion. Slurred speech or mumbling, numbness or tingling in the hands and feet. Rapid or unusually slow heartbeat. Agitation or hostility, especially in the elderly, increased urinary frequency, sudden decrease in the amount of urine, taste disturbances. Unusual milk secretion, enlarged breasts in men, swelling and redness along a vein that is very sensitive to touch and often painful, thrombophlebitis, increased sensitivity of the skin to the sun, weakening of the bones causing an increased risk of fracture, lack of vitamin D, osteoporosis. Very common adverse effects, occurring in more than 1 in 10 patients. Vomiting, nausea, dizziness, drowsiness, unsteadiness, weight gain. Common adverse effects, appear in less than 1 in 10 patients. Headache, dry mouth. Rare adverse effects, occurring in less than 1 in 1,000 patients. Constipation, diarrhea, abdominal pain, joint or muscle pain, increased sweating, loss of appetite, hair loss, excessive body and facial hair, sexual disturbances, male infertility, redness and irritation of the tongue, alterations in skin pigmentation, acne. Communication of adverse effects. If you experience any side effects, consult your doctor or pharmacist, even if they are not listed in this leaflet.